Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. We're back in the studio today, little treatment room. But, if somebody asked me once, like, you ever going to get a real studio? I was like, I don't know now. Like, I feel like this is where we podcast.
I think the treatment room is where it all happens,
right? This is where it all happens. It's kind of like the magic, you know?
That's right.
So I got Dr. Dee Whelchel back with us today. Dr. Dee, she is a boarded equine internal medicine specialist. She's out of Alpharetta, Georgia, has a company, Equine Medicine Consulting Services, which is a really cool deal. You work with us and a lot of other practices. You specialize in equine internal medicine, so when we have cases that need more advanced diagnostics, more advanced treatments, you can come into these practices and provide that.
Yes. And that's, I work through the veterinarians contacting me about cases that they have that they'd like my help with and assistance with. And then we all work as a team with the owner, client, and of course, the veterinarian that's called me in so that we can provide the kind of state-of-the-art diagnostics, get to the right diagnosis and treatment, but also have a team approach and follow-up. So that I think that's the best for continuity of care and the relationships for everybody, client included. And that's our goal. And it also hopefully helps alleviate a little bit of trailering around for some of these people, which I think is kind of nice when we can do that.
Well, I think too, it kind of is able to keep you in a comfortable environment. You know, sometimes there's a lot of intimidation going to bigger facilities or traveling long distance. And, you know, when we can bring that care closer to home, I think that's
a
great thing for all parties involved.
Yes. I agree.
And then one of the cool things I love is every time you come in, we get to learn. So that makes us better.
Well, thank you. I learned from y'all as well. I learned from, obviously, every case we see adds to, just our experience. But also, I think that's the beauty of the collaboration is that there's, just because someone has certain degrees or extra letters, there's experience that we all have that just enriches. So yeah, I love that relationship factor of what I do. It makes it way more fun.
I agree. And that, to me, that's what this job's about. If you're not having fun as a veterinarian, what are you doing?
Right.
Right. I always say, I just don't want a real job. That is my whole goal in life is I don't want a real job. And I have been so thankful because between being a farrier and a vet, I haven't had a real job in 25 years.
I don't know.
And that's pretty awesome.
You work pretty hard, Dr. Carter. So.
Oh, I mean, you can work hard, but I had a real job once. I actually wore a coat and tie when I went to work.
Really?
Yes, I actually had an office. I wore a coat and tie to work. I made it almost 8 months.
I get that.
And I was like, nope. This isn't working. Nope. And I remember I left that real job. I looked down at my watch for the last time. And I remember looking down and I was like, I'm never wearing one of these again. And I literally threw it out the window going over Berthoud Pass in Colorado. Threw a watch out the window and was like, I'm done. I'm never getting a real job again. And so I chose two great careers, being a farrier and a vet, because neither one of them does anybody expect us to be on time. So I see no point in wearing a watch.
Well, they're two wonderful things to merge together for our horses. That's for sure. But yeah, let's dive in today. We're going to talk about Equine Gastric Ulcer Syndrome. I know we've covered this in a previous podcast, probably a year and a half ago. But like all medicine, things change. We learn, we get more information. So we're going to take another look at it. Because there's a lot going on in this field, and I feel like it's a very common thing that I almost don't believe we can talk about enough. It's now the number 2 cause of poor performance in performance horses. Lameness is number 1. Gastric ulcers is number 2. So anytime we're dealing with the problem that a lot of people are having, I don't think you can discuss it enough. So let's dive into it today. Sounds good.
So let's talk about it because being an internist, this is an area that you spend a lot of time dealing with. So let's just start off. What is equine gastric ulcer syndrome? You're going to probably hear us call that EGUS a lot. Just we like to shorten things, but Let's talk about, what is EGUS and how do we get there?
Okay. So Equine Gastric Ulcer Syndrome is an umbrella name, basically, because it incorporates two types of gastric disease. And it's really important we understand that,
yes.
Because they are two different entities. That is the squamous gastric ulcer syndrome and the glandular gastric ulcer syndrome. And, one horse can have one or the other or both going on at the same time. And so that's where our diagnostics really come into play for us to properly diagnose so we can properly treat, and also institute a lot of management things that will help prevent recurrence or manage, severity of disease and relapse. So that's, I'd say we can see this disease in easily up to 50% of our population.
Yeah.
It's quite common. There are some horses that are just probably predisposed despite all of our management techniques, but we also do know there are certain risk factors. And so that's important for us as owners, trainers, barn managers to know there's a lot we can do outside of just treating that can also help prevent this disease from occurring or help keep it at bay, so to speak. So
I think one of the things you've got to discuss is the equine stomach is very unique.
Yes.
Our stomachs are completely glandular mucosa, meaning that it's producing stomach acids, digestive enzymes, and the whole thing's covered in a beautiful slime layer of mucus that protects it. Horses, the bottom half is that, but the top half is what we call squamous mucosa. It's really an extension of the esophagus.
Exactly. And horses are unique that way. And so that's why we see these diseases manifest. As I will say, if you get a chance, listen to Dr. Ben Sykes, but he referred to it as the odd couple sharing the same apartment. And it's an interesting term or way to look at it, because you have this top part of the stomach that has no protection against acid. And yet it is in the same apartment with the bottom part of the stomach that has natural protections and barriers and produces the acids. And because horses are grazing animals, continually eating in sort of the wild situation and foraging, that behavior, that chewing behavior, the type of forage they eat, all of that can kind of come into play to help protect that squamous surface. And then, of course, we've got some natural buffers and barriers in the glandular that we look to maybe also help along to prevent as well that disease. But that's a very, very important thing, that we have these two different compartments of the stomach and that their diseases present a little bit differently and we have to treat them differently. So the squamous top part of the stomach has absolutely no protection against acid. And so when we ride a horse, sometimes that acid at the bottom part of the stomach and the glandular part splashes up, causes essentially a burn and irritation there. And that starts to create this syndrome of squamous ulceration.
One of the things I tell people, the way to think about it is if you've ever had like acid reflux or if you've ever had heartburn, because at least in my little brain, that's the way I think about it, because that's the same tissue as our esophagus.
Yes.
So I just kind of equate it to that's probably how it feels. We don't get to ask them, but my guess that's probably how it feels.
I bet you're right.
And if you've had heartburn, like chronic heartburn, not like I ate too much tomato sauce, for those of you under 40 will know what I'm talking about. When you have that for days on end, it's miserable.
It's miserable. It's miserable. Yes.
And I always say, I think it even decreases human performance. When you talk to people who are dealing with a chronic heartburn, chronic stomach ulcers, their performance is decreased because when you hurt 24/7, your motivation is going to go downhill. You just want this to stop. And
it hurts to eat. And when you're sleeping and you wake up with it. I totally agree. And I think, yes, you're right. Anyone over 40 or 50, you've experienced it. I have just for the last year had my first, run where I'm like, I better get myself on some Prilosec. Yes. And I had such compassion for my horses after that I'm treating. So that, I think you're right. The squamous ulcer is very equivalent to heartburn, whereas the glandular ulcers are probably similar to more of our peptic ulcers in humans. We don't have quite the same pathology in horses as humans in that, but again, probably a similar pain, feeling, and treatments again, duration needing to be longer and things like that. One thing we know is that, probably with squamous ulcers as well, 80% of that can probably be resolved or prevented with a lot of management.
Yes.
And dietary management. Whereas 20%, there's just some horses that are just predisposed and more difficult. Whereas the glandular, sort of the opposite. We feel like there's a lot of inter-horse dependence or predisposition to that disease. Whereas 20% of it's probably controlled with management. And it's also a disease, squamous, we understand so much better, the pathophysiology and, again, the risk factors. And we've diagnosed it for longer. I think probably our endoscopes getting longer and better. We're starting to diagnose glandular disease and see it more. But we also it's still a little bit of an enigma. We know that it is more common in warm blood sport horses. Particularly, we see them to say dressage, but probably, again, all of the English disciplines, hunter jumper, again, 3-day eventing, we see it more in the warm blood population. Not to say we can't see glandular ulcers in other breeds, but it does seem to be common. So as far as knowing the exact causes, we are still a little bit of a black box there. We've done some studies to identify some risk factors, and there are certainly things we can modify. And we know that we have some therapies and treatments that do improve, if not resolve. We know, however, those horses that get glandular ulcers, a lot of them are predisposed to relapse. And so that's where this long-term management really comes into play for them.
Right. And we're going to get into that later in the podcast, because that's a big focus is, that I want to talk about today is how can we keep this from being an issue? A big area of my practice is mostly sports medicine, doing lameness type work. And over the last few years, a big shift has been, as I keep seeing these injuries, paying attention to how these injuries occur. I always say, I need to shift my role. Right now, it is treating injuries, but every day I'm trying to get closer to how can I work with people to prevent the injury?
Right.
And that's what I look at with ulcers. What are we going to do to keep this from being an issue? And that's something we're going to get into a little bit later. One of the things you already mentioned is endoscopy. I see this all the time. People how can we diagnose this without a gastroscope?
Right.
I feel like it's really invasive. How can I do this without using the gastroscope? Bad news.
There's no way to diagnose this without using a gastroscope.
Read a paper the other day. They were trying to look at some biochemical markers in saliva. They were trying to look at it in blood. Unfortunately, none of it was accurate. I know they've tried to use the fecal occult blood test. Again,
not accurate.
Not accurate at all. Not even a statistical trend.
No,
it just doesn't work. So unfortunately, the only way you're going to get this done is with a gastroscope.
That's right.
And I know a lot of people are afraid of this, but I try to explain to people, this is a quick procedure. It is done lightly sedated. Complications are
very minimal.
I don't want to say zero.
Right.
I'm sure they've happened. I just haven't seen them yet. Knock on wood, but minimal risk.
Minimal. I agree. And, it is daunting for an owner. I will say, think about what, a human goes through for this, and it's far easier for a horse.
Oh, yeah.
They're on standing sedation. It's the similar sedation you'd give your horse, actually even less than for a dental.
Yeah.
And honestly, if if the stomach's empty and we have a well-behaved horse sedated through it, typically it's done in the time faster than a dental would take.
Yes.
For people who do know what they're doing and how to move the scope efficiently and get where they need to get. It does not, take hours on end. And so usually, frankly, probably you too, we spend more time explaining our results and what we're going to do than actually scoping the horse.
100%.
And so I think for the bang for the buck, when you look at getting the right diagnosis, getting the right treatment protocol afterwards, understanding the right management changes, it's worthwhile, and it's not as stressful to that horse as probably going around and continuing to work in pain, transport in pain, all those things. And then the side effects we start to see the longer that horse is in pain. we talk about prolonged behavioral issues even after disease is resolved. Some of those horses kind of have a memory of that, and they anticipate, I'm going to go be in pain when I work because I have these ulcers, or when you tack me up. So getting on top of that as fast as we can has a lot of value, I think, for our horses' well-being, our enjoyment in riding that horse, and certainly what we're going to get out of them performance-wise.
Now, when you talk about bang for your buck, you can scope a horse for less than you can inject the socks.
That's right. That's right.
So if you want to look at a real simple way to increase performance and you're worried about this is faster and less expensive than injecting the socks.
And it's certainly less expensive than treating for a month with GastroGard.
Yes.
A whole lot.
Well, and that's one of the things we talk to people about this all the time. And we've already kind of started in there, so we're going to go that way. You've got two different kinds of ulcers. You've got squamous, you've got gastric, and kind of a subset of or you got squamous, you've got glandular, and kind of a subset of the glandular, those nasty pyloric lesions. Depending on which one you have is which medication you need. GastroGard does not cure all.
That's right.
And so knowing which one of these you have is critical, because that's going to be the medication. It lets us know what medication we need to reach for. Because nothing's worse than running 30 days of GastroGard to find out, oh, we actually needed some misoprostol.
Exactly.
We needed some sucralfate.
Exactly.
And you just threw away all that.
$1,200 and a month of time.
Yes.
Exactly.
In time.
Yeah.
That's one thing I talk about all the time. I talk about it on here and with my customers. You can get money back. You can't get time back.
That's right.
30 days in a show season?
It's a lot. It's a lot. So. And then another thing that's important to say is that sometimes ulcers are not the cause of the performance issue.
Yes.
And so we can spend a lot of time treating, trying, and there's a whole nother thing going on in that horse. And so gastroscopy is also important to rule out ulcers and be able to move on to the next thing as well. And then there's a holistic look at our horses that sometimes they have more than one problem going on.
Yes.
And that's also where gastroscopy is important, so that we can understand, okay, there are ulcers here, but are they really enough to be causing? Do we need to also be taking, a look at this horse? Is it sound? Does it have musculoskeletal pain? Does it have back pain? Does it have some other disease process going on?
Underlying neuromuscular disease.
Exactly. That's a huge one that we'll see, like, again, fibromyopathy in some horses with gastric ulcers. Those are a little bit more complicated. I certainly don't want to get someone, intimidated by, there's all these things. But the bottom line is it's an important step to take so that we can really understand the cause of a performance issue and get to the bottom of it, and in a timely fashion to get your horse back to work and doing their job well.
No, and when you look at what we have from an endoscope capability, I think back to, I bought my first gastroscope in 2011. And I think back to those images.
Oh my gosh, that's incredibly changed.
It was the equivalent of those of you over 40, think about when you had your first TV and you had that big huge box and it was like plugged in. You had RCA cables. All right, that was our first gastroscopy. Yes. Now we're scoping on these things that are HDMI or HD 4K.
However many pixels of image. Yes. Yeah, it's amazing. It's amazing.
Like the portable scopes we have now are better than the Olympus scopes that on the huge towers inside hospitals I work in. I mean, it's crazy. Is phenomenal where the technology has gone. It's getting smaller and better. It is incredible.
It is. I think they're also probably things going to come down the pipe. It will continue to advance. Is the bottom line. We are so fortunate. We're in this time of technology, and it's allowing us to bring a lot more stall side and very good diagnostic stall side versus, like you said, I remember it was the TV thing in black and white that half the time you get, lines going through your image. It was, their scopes weren't long enough by any means to get to the pylorus. You were seeing just that squamous surface and the margo plicatus, and you were happy you saw that.
Exactly. And you had to haul them into a big hospital
to do all that.
And now we're doing these things stall side. It's incredible.
Incredible. And I can literally sit there and get an image, and you can too, and I can text it to an owner. I can put it on a USB, plug it in my phone. Hey, here's what your horse's stomach looks like. It's amazing in real time.
I have literally been inside a stomach before, trying to figure out what's going on. Transferred images, had them sent off to a friend of mine up in Kentucky, and before we got the scope cleaned up, he was texting me back what was going on.
Right.
I mean, that's how quick technology moves.
That's right.
That's the beautiful thing about it. Like, it doesn't take long. The equipment is great now. Most of it can be done stall side. As long as the horse is cooperative, we can do the majority of the stall side.
That's right.
And we got you answers. We have answers. And I always tell people too, like, if you go in and scope a horse and it doesn't have ulcers, that means as much to me as it does, because that says, okay, we've ruled this out, not the problem. We've got to keep looking. And I think that's why I love doing a gastroscopy over, like, let's just guess our way through this, because maybe it is, maybe it isn't. But when we know, we don't waste 30 days.
That's right. That's right.
So we get in there, we're dealing with ulcers. We get in, we've got them. Let's talk a little bit about the medications that are out there. This is a hot topic. Yes. I feel like everybody's familiar with GastroGard. It's omeprazole. It's got a candy shell, lets it survive the acidic environment of the stomach. But it's probably the first one we typically reach for. And that...
Yeah, so that medication is proprietary medication, right? There are a lot of other... GastroGard is the FDA approved formulation for horses of omeprazole for treatment of ulcers. UlcerGard is the same medication, really the same substance in a tube, but the way that it is labeled is for prevention, and the dose is different. So all that means is that when I give UlcerGard, I'm giving a smaller dose. I get a little less acid suppression. When I give GastroGard, I'm giving a bigger dose. I give a lot more acid suppression. We need more acid suppression to treat and resolve ulcers than to prevent them. So
I think about Advil. Advil comes in 200 milligram over the counter. If you get prescription Advil, that's 800 milligram.
That's a really good analogy.
That's what I look at. Yeah. It's not that the prescription Advil is better. There's just a lot more of it.
That's right.
So
that's right. But it is, basically our first go-to, because this medication, this drug omeprazole, works by being ingested, making it to the small intestine where it's absorbed, and getting into the bloodstream, and then suppressing the acid pumps, the proton pumps in the stomach that produce acid. So, and it does so in a way that has much bigger effect than some of our other, what we call H2 blockers. So that is why it's our drug of choice. You have a lot of other people out there selling compounded medications, things that they think are, good, hopefully cheaper. It is an expensive medication, but there's a reason that it works. And that's because it has a proprietary buffer that ensures that medication isn't destroyed in the stomach by all the acid, and actually makes it to the small intestine where it is absorbed and can get into the bloodstream and then go back to the receptors in the stomach to do its job. And those compounded medications don't have that necessarily proprietary buffer. They are not FDA approved. And as veterinarians, we should be prescribing the medications that are. But more importantly, you don't know what's in them. There's no quality control. There's no one out there saying this has this much drug in here. There's not other things that shouldn't be in those compounded medications that could actually be harmful. So, it certainly isn't a way to know we're giving a treatment that's going to guarantee to work. And we know that with GastroGard.
What I tell people all the time, the most expensive medication is the one that doesn't work.
Yes.
Price is what you pay, value is what you get. Average cost on the treatment of GastroGard, it's expensive. It's $1,200. But it's $1,200 that works. I would rather put my money there than a $200 medication I know that won't work.
That's right.
I tell people all the time, like, if you're using a compound, and some people may get upset at me. I don't care. It's my podcast. But if you're going to use a powdered omeprazole, I recommend sprinkling it on their back, because it's going to be just as effective there as it will if you ingest it. And you don't have to fight with them near as much.
Right.
And it's going to be just as effective.
Just as effective. That's exactly right. That's exactly right.
Use what works. Like, and if there was another option, I'd be all aboard about it. But you know what? There's not.
There's not.
So I think that's
use that.
Yeah. That's what you need to know about it. That there's a reason GastroGard costs more. And I always say there's a reason it's gold in color.
That's right. That's right. And one other thing while we're on it, we've seen this. I don't know if you've seen this. There's you can buy, quote unquote, GastroGard or UlcerGard on Amazon. Please do not. There's counterfeit product. It has been, we've seen it in our clients' hands. It'll come out looking like very similar packaging, very deceivingly packaged to look like the real product. It is a cheaper price point, not dramatically, but cheaper price point than, maybe getting it on other sources. And it is counterfeit. The company that makes GastroGard, UlcerGard will verify that as well. You can actually squirt the medication on your hand and compare. It's very different looking. So just a warning for owners. That's not a good place to source your GastroGard or UlcerGard.
No, we've actually seen a couple cases of some oral ulcerations and some actual chemical burns on the lips from some of these generic products. Just like I said, when that counterfeit product is terrifying when you get into the counterfeit industry. Right. And we've seen this for a long time with different products. I can remember back when Frontline was a big one. They'd counterfeit the burns we were seeing on dogs. Like, stay away. Buy from a reputable source. It needs to be through. I always say buy it from a veterinarian if you can. Yes. Because there's a guarantee backing you up. Buy from reputable pharmacies if you're going to get it. Reputation is everything in this game.
That's right.
So,
and one more thing, there are a lot of times there are rebates on these, that if you get it through your veterinarian, you can get a rebate to send to the company, get a fair amount of money off. So, but anyway, that is our go-to treatment for squamous ulcers because it suppresses acid. We often do use it in conjuncture sometimes with glandular ulcers, depending on where we are in that course of treatment, because acid suppression can help those, although we need more.
Correct.
And so that's one of our medications that we go to and use. The second medication or second kind of set of medications I talk about are those for the glandular ulcers. And that's where we talk about sucralfate and misoprostol. Sucralfate is sort of a wonder drug. It has a lot of
I want to dig into this one because I've been looking more at it, and it does way more. Like, we're finding out it's doing way more than what we thought it did. So let's dive in. So we'll dive in a little bit, and I'm going to also lean to you because I know you just read up on this, and you may have some things to add. But we used to think of it as sort of the Band-Aid, that sucralfate binds to any area of irritation and acts as like a natural Band-Aid to soothe it, and that helps it heal. It does more than that. We know that it probably helps on that buffer layer in the stomach to help maybe bring back some of those protective things in the glandular stomach. The glandular stomach secretes acid, but it has this nice little buffer right at the surface, right at the cell level that actually brings up the pH. It secretes bicarbonate, has a natural slime factor, and we feel that sucralfate has some beneficial mechanisms in that. We know, or we think that even sucralfate may have some beneficial mechanisms in hindgut and other kind of like, again, epithelial health. I'm going to lean to you because you just read a great paper on that. Add to it, Dr. Carter. This is one of my favorite things to talk about because I love a fibroblast. Like, to me, a fibroblast is like the wonder cell of the world. And I guess that's because I've spent most of my career talking about collagen in one way or the other. Like, you work on tendons and ligaments, like you're talking about collagen. And you can't have collagen without the lowly fibroblast. I mean, red blood cells are cool. You carry oxygen. Yay. Fibroblast, that's the unsung hero of the body, right? Like, nobody ever talks about the little fibroblast.
They don't.
I love the fibroblast.
Okay.
So one of the things that helps out was it prevents fibroblast degradation. And when you think about a stomach ulcer, I remember going all the way back to high school biology. The GI tract is a tube inside a tube, right? It is the outside world inside the body. So it's the tube going through. And really the entire GI tract is modified epithelium. And we're talking about squamous ulcers. We're talking about glandular ulcers. It's modified epithelium, which is modified skin.
That's right.
Skin heals through fibroblast. And when you have a stomach ulcer, I love the way Hoyt Chermy put it. He said, you have a wound. A stomach ulcer is a wound. You have to heal the wound. So even if you treat the pH issue, you still have to heal the wound. And we'll talk about this a little bit later, but wounds can get infected. So that can definitely happen. But what heals wounds is a lowly fibroblast. And so if we've got a medication that can prevent fibroblast degradation, and so that means those fibroblasts can actually get there. They can go to work. They can start laying down that fibrous tissue, because that's what we got to lay down first before we can get epithelium. Yeah. We've got to have fibrous tissue. We've got to have collagen. So if we anything, save the fibroblast, save the world. It's like cheerleaders. Save the cheerleaders, save the world. Save the fibroblast. So yeah, that was a cool thing I was just reading up on this morning is, and so that just piqued my interest. And so, yeah, like it has all those other great effects. Plus we can actually increase healing. Like I made the decision today. I was like, well, I'm going to use a lot more sucralfate.
Yeah.
Because I've always looked at it. It was the Band-Aid.
Right.
Band-Aid.
Right.
Looking at these other effects, I think it needs to be on board.
I think it's a great medication. And then if you've ever had any esophagitis or really bad gastric reflux, your doctor will prescribe it. And if you've ever taken it as a human, you take it as a slurry, and it does give a pain relieving effect, I think, to us as it coats and promotes, again, does that barrier. But like you said, it's more than the Band-Aid. And I also, although I did label it to kind of be more of a glandular treatment in really severe squamous ulcers, I use it as well, because I do want that healing effect. And I do feel like it just gives a comforting effect of pain relief for these animals as well. But that is one of our big tools in glandular ulcers. Our second is misoprostol. And basically misoprostol is a synthetic prostaglandin. And one of the things at that barrier surface of the glandular stomach, at that cell lining, is we need the production of good prostaglandins to help promote cell healing. And again, it's one of the barriers and protective mechanisms of that lining of that stomach in that area to acid damage. And so that's what misoprostol does. It basically helps to supply that at an extra level, so to speak, and help promote healing. And so it's an expensive drug, but we have some small studies that show it helps to resolve glandular ulcers in a faster time than not using it at all.
I'll tell you just some clinical experience I've seen is horses that were being treated, they were guessing their way through GastroGard. We got them scoped and found out, we were dealing with these glandular ulcers, the second subset of like pyloric ulcers. When we got them on misoprostol, it was amazing how fast these horses started to feel better. I mean, I'm talking started on Friday and looking better on Saturday. I mean, it is very rapid how fast those horses improve. So yeah, if you're dealing with a glandular or and that subset of pylorics, you've got to have this medication.
I think especially for the pyloric.
Oh, absolutely.
And that's another thing when we talk about the pyloric lesions. The other thing we want to try to prevent, and some of these horses already have it, but the remodeling where we start to develop the polyps that are just... Oh,
I don't know what you do with those.
They're difficult, and it's a constant management after that. But if we can kind of keep that epithelium as healthy as possible there, and kind of really get the best resolution, hopefully we maybe prevent those.
Have you heard? I know a couple guys were looking at using the cautery snares on these. Have you seen? I haven't seen a whole lot of data yet.
I haven't seen a lot of data. I do know, especially I think there's some of the internists in Europe are playing with that and think that there are some, especially these chronic ones that just keep getting irritated and irritated. There's definitely some efficacy there. There's even talk about like, could you laser ablate? I mean, that would be a really cool thing. I think.
Was a couple guys using these cautery snares, using laser ablations. A couple people doing it, and I'm excited to see some papers coming out. Yep. My thought, if I can go in there and rope a polyp with an endoscope, if I can go in and get to play cowboy with an endoscope.
How fun. I
mean, I'm in. Sorry. I do 3 to 4 endoscopic procedures a year, and the thought that I could like start roping polyps, like I'm in. Or shoot them with a laser.
Right.
I mean, if I can go shoot them with a laser beam, I'm in.
Right. So, and, anyway, I think that is coming. It will be in the pipeline for us to use more and more. I think some of even the endoscopy companies are looking at how do we make this feasible for equine.
Right.
So that will be a really nice tool there. But I know we talked about medications. So those are the mainstay medications. Omeprazole as GastroGard, misoprostol for glandular, particularly pyloric lesions, and sucralfate that can be used definitely to target our glandular lesions, but sometimes in our severe squamous ulcer cases as well. I want to step into compounding and mixing all these medications.
Yeah, let's talk about orders and
a lot out there. There's, the omeprazole misoprostol combination. There's the sucralfate misoprostol combination. I know these drugs are often difficult to get. They're expensive to get. I do prefer, even with misoprostol, to use the actual true medication, the true pharmaceutical versus a compounded. Anecdotally, talking to practitioners who use more of those, I think there are some compounded forms of misoprostol that they're feeling are efficacious and having some, and that is a cost benefit. That is maybe the one I'd say, okay, if you've got to, you can try that, but realize it may not be quite as good. But I don't like it mixed with other medications, pre-mixed. I think that's just a question of what's really in there. And I still come back to...
Especially when you get into paste.
Yeah, paste, exactly.
When you start getting into paste and suspensions, a lot of things. I mean, if you want to do chemistry, if you take two powders and shake them up, not a whole lot happens. You add a liquid medium,
right?
And it has to do. I can't get into that.
I agree with you. We just have no idea what we're doing to those medications, and there's no quality control to say are they really working. And so certainly, if I have a severe case of glandular ulcers, my gold standard is to use true pharmaceutical grade misoprostol. It's just, we know our bang for the buck there.
Yep.
And I'd rather use that for 28 days than have to be treating for, 2 to 3 months with the compounded that we just don't know the efficacy as well. Yep. So.
And we use a lot of the compounded sucralfate, but I actually talked to the lab that does our sucralfate and they're like, damn, we're basically just getting it before, like, it's just, we're grinding the pills up for you.
And that's one I have no problem with that.
Because that's the hardest thing in the world, right? Is
the pill. Yeah.
Is the pills. Because you want to talk about, take a minute. Sucralfate, there is one form of sucralfate. They're just asking the colorblind guy, but there's like pink tablets, I think.
Yes.
Those dissolve really well.
Yes.
The white ones, like, they dissolve.
I think the pink are what you get for humans, essentially, and they dissolve much better.
Yeah. But that's one of the areas I will like sucralfate powder. Like, okay.
I'll also fudge on that too.
Yeah.
I do, again, in maybe the more acute phase, like to use the pills. I like to make a slurry because again, I just feel that maybe there's a bit better contact with that. But again, as a long-term or, kind of out of that acute phase, I think, like you said, these companies are probably just grinding up the pills and putting it in the powder.
That's what they told me they were doing. So we're just grinding this for you, Dan.
Yeah.
One of the things I look at too, when we're talking about medications, we've talked about mixing them before they go in, like in these pastes and powders, but there's been a lot of focus over the last few years about when to give and all this timing stuff.
Yes.
And one of the things that, like, I want to talk about that because I feel like when I first started treating gastric ulcers 17 years ago, it was like, just get the medication in them, just get it in there. And then there became, there's this whole, please excuse my dear Aunt Sally order of operations of, this thing just got way too complicated.
It is complicated.
But let's talk about that.
Yeah. And it's not practical for, I feel like, any barn manager or owner. So the biggest sticker, I think, is, then this is one that we really need to abide by, is giving that GastroGard on an empty stomach first thing in the morning. And that is because if we give, our tube of GastroGard and then go give that horse a bunch of hay or grain, the medication mixes in and it's not as effectively absorbed. And you're giving an expensive medication. We need to know it's getting absorbed and working well versus getting stuck in a hay bolus and not making it, getting that absorption we need or desire. So we want that medication given 30 minutes to 60 minutes before feeding anything. That sounds very difficult, but if you're in a barn with multiple horses, you go in and give that horse its GastroGard first thing, and then go do your other horses and come back, and probably you've met that timetable.
Yep.
The other thing is with that, we talk about horses with ulcers and that continuously eating forage is helpful for prevention. But when we're treating, we don't want to fill up that horse's stall with hay for it to have all night long. So we don't want the hay net full of hay, because we do need that horse's stomach empty to absorb. That might change after we've treated and we go to management. There's a little bit different in feeding protocol there. But we give, our typical kind of nighttime 2 flakes of hay, 3 flakes of hay at say 5, 6 o'clock at night. Don't come back at 12 o'clock, 10 o'clock at night and give more hay. We need an empty stomach for absorption.
Well, the good thing is too, horses have this natural fasting period. And
yes.
I feel bad for whatever nerd had to sit out there and stay up all night, but they kind of fast from about 11 p.m. to 6, 7 a.m.
Yeah, they do.
So they're looking out for you here. And if you run out of hay at midnight, 1 in the morning,
they're not going to die.
they're already naturally fasting at that time. So we're not saying, because we talk about we want a full stomach all the time. They already have a period that they're emptying this out.
They're going to have a period where they don't eat and they actually rest. So
now that means we need to feed them and give them the GastroGard before like noon.
Yes.
This isn't teenage morning.
Right.
This is normal. I got a job morning.
That's right. That's right. And because they do produce more acid because of that fasting time that occurs, again, some horses it's 1 to 7, whatnot. Others it's a little longer, 1 to say 11 to 6. But we know on that empty stomach, that's when the acid is the worst. So we want to give it first thing in the morning. And not at nighttime where they've been eating all day, grazing all day. The other medications, it used to be the school of thought that you cannot mix sucralfate with anything, that it binds and that it causes interactions. That's largely been disproven. There are certain medications, if you were to go to the list, they are more medications that are used for like seizure treatment and other things versus gastroprotectants. So we probably can give it at the same time as our GastroGard, if that's easier on management. Versus say we're going to give GastroGard, then come back 30 minutes later, give sucralfate, and then come back and give misoprostol. Sometimes we're on all 3 medications, and that's
it happens a lot.
It happens a lot. So probably we could do that. And we probably could even give misoprostol at that same time as well. Again, the likelihood of causing an interaction is some less. And in my mind, I think misoprostol is a little easier given on the feed. It's less human contact. And then that's another thing we're going to talk about here. So I tend to say sucralfate GastroGard, misoprostol on the food. And again, whether there's some absorption issues, the biggest thing is misoprostol can have side effects for humans, particularly women, and absolutely pregnant women have no business touching that because it can cause abortion or loss of the fetus. And so we do not want to have any risks there. And I do feel like putting on food, it's a little easier than getting the pills in the horse, dissolving, having to syringe that. Also, a little less chance of residue for other horses having contact. Again, if you have breeding horses, big deal. And that may be a choice not to use that medication in those barns, to just stick it out with sucralfate and some other techniques, which is a fair conversation.
It's definitely one that you have to weigh. And like I said, the one thing, we stress this all the time, and I don't think you can say it enough, is if you're pregnant, do not touch this medication. Get a friend. Yep. Get a friend.
And really, you shouldn't be touching the feed tubs or anything that could have residue. I mean, stay away. Yeah.
Stay away. So
very important.
A popular topic that, because the medications, I feel like there's getting to be more and more that generalized consensus. Like we understand, this is what we've got to do. Let's dive into this one. And this is one that's asking, what supplement can I use?
Oh, supplements.
And I'm like, vitamin E has been shown to help.
There's a lot, right? And a lot of loose evidence, right?
Yes.
And it's very frustrating. There's a lot for owners that are constantly bombarded with products and supplements on Facebook or Instagram, anywhere they look. When you look at a supplement and you're going to look at using it in your horse, the things that we like to see is that there's evidence-based medicine behind it. And what that means is there's a peer-reviewed study that looked at using this product in horses and then also compared to placebo, where they didn't use it at all, and did they see positive effect.
And peer review means like actual people that know what they're talking about, not your peers down at the horse show.
That's right.
Tried it. So
right. That's exactly right. It's going to be published in a veterinary journal where other, again, specialist veterinarians, board certified in certain areas, again, internal medicine, have reviewed that, and it's met a standard of what they feel is acceptable. And the data is backed up, and that the data has good statistics behind it. And the study design, again, is also appropriate to draw the conclusions we're drawing out of it from it. In addition, it needs to be something that's palatable for our horses, and that as also, again, we get. This is the hard part of supplements. They're typically not regulated. So we like to know it's got what in it, what it says it's got in it. It's from a reputable company.
Proof of efficacy.
Yeah.
It just has to be proven not to hurt.
That's right. And so knowing it's from a reputable company, which sometimes has a higher price tag, but those, again, I think Platinum Performance, reputable. I think Kentucky Equine Research, reputable. I think Kileto, reputable. Those are, things that we lean a little heavier towards. And then results, right? You see it again. There is some anecdotal. I'm going to say with supplements, there's some anecdotal.
Yeah.
Knowing that, okay, I've used this as a vet. I see improvement in my horses with this, and I like this product. So one of the supplements out there that I would say there are two I actually feel are really good as far as evidence-based, but I do feel like the Protect GI.
Absolutely.
It's got studies behind it. It has one of the leading internal medicine specialists that does the most gastric ulcer research out there, the biggest advocate for gastric ulcer research, treatment, therapy, management, Dr. Ben Sykes. He has done the research with this product. He has backed it. So to me, that's huge.
And it goes back to that product goes back to the lecithin.
The lecithin pectin.
Yes, the lecithin pectin, the slime.
The slime.
I call it the slime.
That's right.
And that's what it goes back to, which, when you go back and look, that theory and those molecules have been around for a long time. They've shown the efficacy, just the availability hasn't been there. And Ben basically made that happen.
He did. And in a supplement, they tell you, again, dose is important. Like you want to be able to be getting enough in there. It also has a buffer for buffering acid. Right. So it is doing two things at once. And I think it's good for both squamous because of that buffer. And then also definitely it is the supplement I go to for glandular. There's another supplement by Smart Pack that a much smaller study, and it came out kind of first before Protect GI was out there. The Smart Pack Gut Ultra, which also should have, again, those pectin, lecithins, but I feel like the Protect GI is a better product. It's more guaranteed to be better study behind
just
it.
Having looked at it, because there's another product called Reline.
Reline as well. I was going to mention that as well.
And I've been used and had people be a part of all three. And I first started, I feel like every time I use something new, I'm like, you know what? Nothing else is working. I'm good. This is the worst of the worst. We got nothing to lose. Go for it. I always feel like that's not a fair test for the product, but it's also like, well, if you're going to be a gangster, go do some gangster stuff here. Let's see what you can do. So I threw Protect GI at them, and I had a horse chronic issues. It worked on that one. I've had several that it's worked well on. Now, I don't want to go out there and say like everybody jump on Protect GI, Reline, but I will say as a very anti-supplement person, because you got to convince me. Yeah. It's starting to convince me.
Me too. And I feel like the Reline, I have some horses. I usually give owners a little, basically some choices because of financial, here are your options. And for me, it's Protect GI, first gold standard, Reline, and then the Smart Pack Gut Ultra. I think the Reline product has some potential to help with that coating, that again, helping to provide that buffer. I just, again, feel that the Protect GI has better evidence-based medicine behind it. And again, not to dog the people that I have had clients that swear by it for their horse. It's the one thing. I also think there may be some inter-horse dependence. We haven't quite gotten there, but I think there might be.
There's a lot of, I think you've hit the nail on the head there. Like, there is so much inter-horse dependency on these things.
Yeah.
And I think that's why nothing's like, yes, this works.
That's right. And so the reline might be better for one horse than it is for another. And so there may be some play factor in that as well. But beyond those three, I have not been convinced to go to anything else for me personally. Not saying that there's not stuff out there that's working for other people. Those are just my three go-tos.
No, I agree on that. So, well, I'll tell you, that was, I'm trying to think what else.
One more, though.
Yes, let's talk.
Outlast. I do think Outlast has a place and a use. I think Outlast is basically, again, well studied. You know what's in it, produced by a reputable company, Purina. And I think it needs to be part of the repertoire of management and these horses. So great to give right before you ride. Great to give right before you trailer. We know it binds and reduces the acidity. So
well, and I think that's important because you'll hear me talk about buffers are useless in horses, and I've really kind of changed my thoughts over the years. Buffers, because buffers don't last long in the horse. But something like Outlast, we get that 2 to 4 hour relief in buffering capacity. Well, 2 to 4 hours, that gets you through a class.
It does.
That gets you through trailer.
That gets you through exercise.
Right. Yeah, so that's, I think I've really changed my thought on buffering.
Yeah.
I think it's about strategic use. And so I think using the Purina Outlast, because like I said, we know we're going to get that 2 to 4 hours buffering capacity. So using that before we're trailering, using that before we exercise, before we ride, before we're going to be sloshing acid around.
That's exactly
stomach.
right.
Yeah. Get it in there 30, 45 minutes before you ride. Get it in there 30, 45 minutes before you trailer. And I'm one, like I'll tell you, because if you go back and listen to my other podcast, I'm going to talk trash on buffers. But you know what? We learn.
Yeah.
My favorite saying is in 1926, Pall Malls were the safest cigarettes for pregnant women to smoke.
That's right.
You know what I mean? Guess what? We learn.
Right. We learn.
That's why we revisited this. Yeah. We learn.
We learn.
So yeah, I'm 100% changed my opinion from the last podcast, and it's my podcast. I can do that.
So you can. That's right.
Yes, yeah, I do think buffers are important. So,
one thing we talked about medications, we talked about timing. Another thing is talking about exercise and acid control with that. So I think most horse owners are kind of getting more savvy to this. We learned as kids, don't eat before you swim, don't eat before you exercise.
Don't feed your horse before you ride.
Right. Big thing. You're going to get a colic.
Oh, yeah. It's going to flip the gut.
Right.
Twist.
We have changed our views on that a little bit, and that it's actually beneficial to give a hay meal. Even probably the best would be alfalfa.
Absolutely.
Because it's got some natural buffers in it, a little bit more than our typical grass hays. And that small, it can be a fourth to a half flake. What we're going to do is create a hay bolus in the stomach that binds up that acid and prevents it from splashing as we ride. When you ride that horse, we can actually look at the amount of acid splash that occurs. Yeah. And when we start trotting, we start engaging the core, which we all want to engage the core in our horses. We are pushing acid up into that squamous mucosa. We are causing irritation. And even in the glandular part, the more we bind of that, the better for helping. So we actually do look at that as a positive thing to do before we ride. And that's where, again, we can use it either in conjuncture or separate, but from our Outlast supplement as well. Very, very useful.
Absolutely.
And so important. Another thing is timing of riding. Ideally, which is not easy for us to say, but afternoon's probably better than early morning just because of the acidity.
They've eaten more.
They bound more acid. Again, are we going to be able to do that every day in our life? No, but just cognizant things that if we can. Yeah. For treating a horse with bad ulcers, that might be something we talk about a little bit more. So
I think this is a pretty good talk. Like I said, it's kind of amazing, this conversation versus one of the first episodes we did was on EGUS. And it's interesting the things that have progressed in such a short period of time.
Yes.
And what we're learning, what we're understanding. And I think because there is this renewed focus on equine gastric ulcers, because it's a huge issue. And so we know this is important. We're learning more and more. And So it's been a fun episode for us. So
well, good.
I'm glad you were here.
More to go into. It has.
I was going to say we're gonna probably dive into a few more. Hoping Dr. Whelchel here will be on more of our podcasts as our guest internist. So we're gonna probably I got to think we probably do a whole one on just feeding.
I was going to. I think
these horses.
We could. There's a whole. That's a whole lot of information that's come out there.
So
it's changed and different from what we used to think.
Stay tuned. We're going to do that one.
That sounds good.
All right. Well, thanks for being here, and thanks to all our listeners out there for tuning in and paying attention. I'm supposed to ask y'all to like and subscribe. If you like the podcast, like and subscribe helps us out. If you don't want to like and subscribe, don't. Again, we're doing this for fun, and we're doing it to have a great time, but most importantly, we just want you listening. Listen and learn. If you want to like and subscribe, that'd be great. If you don't, you just want to listen and learn from somewhere else and kind of in the shadows, we're cool with that too. So we appreciate it. Dr. Whelchel, thanks for being here. April, thanks for recording this. Casey, thanks for doing all the editing, and to all our listeners out there, I hope you'll have a great week from Countryside Equine Hospital. Take care.